This is shame avoidance.
Shame avoidance. It's a shame avoidance to oneself, though. I mean, it's not only the external. I think we often think about the child who is developing behaviors to cope in terms of how other people are going to treat them. That's certainly important. But I think ultimately it comes down to how you feel about yourself. And can you trust yourself to get through the world, to keep you safe, to perform well, to make you feel good about yourself. And a lot of that has to do with automatic processing and automatic control of the information that's coming into your world. And I think that a lot of children who are struggling with that will develop a lot of compensatory behaviors to try to gather a sense of being in control. Even if it makes them get in trouble, at least they were in control of getting in trouble, whereas they cannot be in control of failure if they really can't do it. And that feels a lot worse. So that's just a theory. It's not scientific, you know.
I was telling you about affect science.
Right.
Really right down the pipe of that. And
yeah.
I think you'd really enjoy it. And it's an important connection to bring those worlds
Well, that's
together.
why I'm saying some of this, because you might be able to use it. It's not my scientific theory, but it is my experience with doing psychotherapy with families of children. I mean, one of the things that has been so interesting is if you have a family in family therapy, and they've come primarily because they have a child who has a learning disability, and you get started talking about the child with the learning disability, what you often will find is that there has become so much focus on the learning disability for this child that the rest of the family, even the brothers and sisters, when you ask, if you go around the room and you kind of ask everyone to say something positive or good about what an individual person is good at, you know, for the other kids in the room and the family, you know, he does this, he does that well, whatever. We get to the child with the learning disability, they're always trying to figure out something academically that child is good at. Well, that's kind of tough, you know. Well, yeah, he can kind of do math pretty well, you know. And yet the rest of the family, they haven't focused just on the academics, but this kid has just become the academic part of himself. And so you say, well, isn't there anything else this child does well? Well, I don't know. He's not really good at spelling, and he's not really, he's terrible at reading and everything. We say, well, what about other things this child may do well? And so, well, kind of okay at geography, and you finally say,
teach to the test, though,
yeah,
isn't it? I mean,
but
like
yeah, exactly.
down.
And then you finally say, well, you know, does he have any friends? Oh yeah, people just really like him. You know, he's so nice, and the neighbors. Well, doesn't that count? Oh, I thought you just meant about academics. You know, well, they have gotten so focused because the school has gotten so focused, and everything's become about this one area the kid is not good at the exclusion of all the other abilities his child does have. And so, I mean, many times the therapy is just about kind of rebalancing for the parents that, I mean, one of the things I often tell kids in private is, you know what? When you grow up, no one's ever going to test your reading again. You know? So, and sometimes, you know, getting the parents involved in doing the testing has been really interesting because we do family genetic studies and we test all the members of the family, and just to see them remember what it was like to be tested. A lot of times they've forgotten how uncomfortable
they're developing this new thing for parent report cards.
Oh, parent report cards. Oh, cool.
Parents are going to get report cards on how well they're participating in their child's education.
Cool.
As we come to the end here, I do want to give you a chance to as crisply as you feel comfortable with, nail on a few questions. And speaking of tests and what have you, the 2000 reading report card, National Reading Report Card, effectively says that 60% of our 12th graders are below the level of proficiency, 69% of fourth graders. I mean, this is not a minor part. This is the majority. We could say most of our children are less than proficient in reading after 12 years of our attempts to teach them, on the one hand. On the other hand, we've got NICAD saying that the first consequence is damaged self-esteem, that children become ashamed of themselves in their inside loneliness of this whole reading experience. So it seems to translate to me that our education system and our approach to reading in general is teaching most of our children to be ashamed of their minds.
Yes. Well, you know, the statistics on the negative sequelae of failing to read are horrifying. And we continue to think about this as a small problem. It's not life-threatening, that's for sure, but it can be life-destroying for a lot of individuals, and we tend to forget that. And so it's remarkable that there's no insurance coverage for most of the families who have children with these problems. There's very few physicians who are more than just aware of the problem. There's very few individuals who specialize in this problem. I mean, many parents have said to me, if I had a child with any other problem, I would have some high-level professional with a medical degree to take this child to, probably, to deal with the problem, and I would have insurance to cover it or whatever. But if my child has an educational problem, I'm on my own. Me and the teacher, who are very well-meaning, but many times don't really know what to do with the children who have a lot of difficulty in this area. And at the same time, we know that the long-term sequelae, first of all, we know remarkably that if you know a child's reading ability by the 3rd grade, you generally have a very high ability to predict whether they're going to graduate from high school or not, and what their abilities are going to be and what their future is going to be. So by the 3rd grade, I mean, that's the reason we hear all children will read by the 3rd grade. We know that's highly predictive. Well, what are the rest of the statistics? I don't know if you want to hear the horror statistics, but it's quite remarkable. I had the opportunity to give a report to the Biomedical Research Caucus, Congressional Biomedical Research Caucus, so I went into looking at the statistics. And I can get you the actual statistics. I can't remember the actual numbers, but it's something like every public major concern has a much higher incidence of reading problems attached to it, from juvenile delinquency to teen pregnancy to failure to graduate from high school to drug problems. I mean, you take anything that it is that we say is a major concern, and there's a higher than expected incidence by far of individuals who have had struggled with reading or had a frank learning disability. It costs twice as much in real dollars to educate a child in special education than in regular education. And yet, through the history of maintaining statistics and all the additional money that has gone in, we have seen a flat line in terms of the actual effectiveness of our current ability to remediate these issues. And yet we know that all these other problems are on the rise as we have more and more children who are having difficulty in learning to read. So we do have a national crisis, well, probably an international crisis, but we do have a major crisis in this area.